Hi everyone, welcome to Research MD. This is Dr. Pramil. I work as a Chief Medical Officer in the United States, also an Associate Professor of Medicine. Today we're going to bring your attention to a recent development, the role of honeybee in detecting lung cancer. Okay. Now, if we look back in the history, there's always several reports about the animals detecting cancer. I remember, a few years ago, the dogs were finding they can actually smell lung cancer, especially, skin cancer in melanoma. Okay, there are several reports about that. Recently, there are reports about dogs picking up COVID-19, and there were some studies that came out of it. Okay, now when we talk about lung cancer, one of the deadliest cancers becoming more and more common in the United States. I think it's become second or third common cancer in the men, and the implications for the patients is extremely high. So what do we usually do for lung cancer screening is we go for their CT scan, and we have some protocol, and we do the CT scan to make sure that they don't have a cancer, so we can detect early. So it's very, very important to detect lung cancer in early stages. But anytime we do a CT scan, it involves a lot of radiation, and people get scared of, nobody wanted to get unnecessary radiation into our body. So today we're going to look at honeybee and the role in detecting lung cancer. So the honeybees, how do they recognize smell lung cancer? So let's find out about honeybee, the olfactory, the smelling capabilities of honeybee. Okay, they have a complex olfactory system which kind of help them to navigate complex environment, reproduction, brood care, and defense. Those are the main things they can differentiate. Okay. They can can be used to detect specifically the cell. Now, how does the lung cancer detection work? The human breath contains a lot of chemicals which are called volatile organic compounds, okay? And this contains like thousands of products. So when you have cancer, some of these chemicals from the cancer kind of broken down and released through your breath. Okay, so those are called volatile organic compounds. Now, with the different diseases, you can have different things kind of released into the breath. Okay. So the next, what we need to do is different type of cancer, again, different product, okay? Even lung cancer have so many different types of this. So what did the honeybee do? They have this olfactory receptor neurons in their antenna. Their antenna have this receptor called olfactory receptor neuron, which pick up this volatile organic compound and send it to the antennal lobe of the brain of the honeybee, and they process it, and they can differentiate what different type of chemicals are in there. So the scientists who published the study, they looked at this, the olfactory capabilities of honeybee, and they took two group of people. First group of people, not group of people, they used the synthetic lung cancer markers in one group, and the other thing without, like a placebo. And by using this honeybee, they connected this neuron with electrode to the honeybee's brain, and the honeybee was able to detect almost 98 to 100% of the time there is a cancer. And the beauty of it is, they can also differentiate between different types of lung cancer. Like there are main two types, non-small cell cancer and small cell cancer. So that's how accurate, that's the biggest, breakdown of the study. So this is a tremendous impact in the future for cancer detection, especially the lung cancer, because again, I said that current method is using radiation or CT scan, which have like a lot of damage to the system itself can cause cancer. That's why a lot of people don't want to get a CT scan. So amazing study. This opens a lot of doors, like further studies are needed, but this is very, very good for the in the cancer world. I just want everyone to be aware of it. We'll finish with a joke. When does honeybee get married? When they find honey. Okay? That's the joke of the day. God bless. Thank you for watching.